Welcome to the second module of Biosafety Training at UW-Milwaukee. Module 2, Risk Assessment and Biocontainment, will discuss risk assessment in regards to work with infectious agents and biosafety levels of containment. What is risk assessment? Risk assessment is a process used to identify the hazardous characteristics of a known infectious or potentially infectious agent or material, the activities that can result in a person's exposure to an agent, the likelihood that such exposure will cause a laboratory-acquired infection, and the probable consequences of such an infection. By assessing or evaluating risk, we can evaluate the severity of the consequences and how likely it is of that consequence occurring. Risk assessment identifies hazardous characteristics of known or potentially infectious agents or materials, the activities that could result in an exposure to an agent, the likelihood that such exposure will cause a laboratory-acquired infection, and the probable consequences of such an infection. So who does the risk assessments then? Well, this should be a collaborative effort. It should also be done individually prior to experiments. When should the risk assessments be conducted? When changes in the research occur, either new agents, a new lab space, new information, or renovations occur. If you have an incident, an accident, or an exposure, follow up and do a risk assessment to evaluate what went wrong and maybe what could be changed for the future. Also look at high risk and problematic areas and do more frequent risk assessments in these areas. Why should risk assessments be done at regular intervals? It is important that you are continually ensuring that there are best practices in safety being performed and maintained at all times. This reduces the risk of an accident, an injury, or an exposure event from occurring. Biorisk management can be summarized by 5 key points that you need to follow to ensure that you're doing a thorough risk assessment, implementation, and evaluation of all of your procedures and practices in your laboratory. First, you do the information gathering and the identification of the hazards. Second, you prioritize your risk, looking at probability versus consequence. You determine the additional safety precautions that are needed to reduce the risk through risk mitigation. Then you implement all of the different pieces of compliance, so biosafety protocol approval, a biosafety manual for your lab, and standard operating procedures. Finally, you review and evaluate and adjust as needed. So this is where it becomes important for those daily checks, group meetings, annual reviews, biosafety lab visits, and protocol renewals. There are 3 pieces to the information gathering process that you need to investigate prior to commencing your work. These include the lab environment, the biological agent, and the host or the lab personnel. The environment of your laboratory includes looking at your laboratory design, how the lab is organized, and the cleanliness of the laboratory. You should also assess the techniques that you plan on employing or the manipulations planned for the experiments you plan to do with the biological agent. Another part of the laboratory environment are the engineering controls you have available in the lab environment, such as a biosafety cabinet and centrifuges with enclosed rotors. The last piece of the environment is the location, and the location matters because it depends on where you are located as to the requirements for containment for certain types of work. The second part, biological agents, of course, is assessing the agents that you plan on working with. You will assess the routine characteristics such as virulence or pathogenicity, concentration that you plan on working with, the routes of transmission of that agent, the infectious dose, its stability in the environment, if there have been laboratory-acquired infections reported for that agent, where it originates from, how you inactivate it after you've completed work with it, and the risk group. The third piece, the host or the lab personnel, should be also assessed. So if you know that you may have pre-existing conditions that could put you at greater risk for a potential exposure event to occur, this should be discussed with your healthcare practitioner before beginning work. Training and education are also critical in understanding the effective work practices necessary to minimize risk in the laboratory. Language barriers may also be a challenge, as some researchers may not read or speak the language that is being utilized in standard operating procedures in that research group. So make sure that everybody is on the same page and can interpret and understand all of the procedures that are being presented to them. The other piece is PPE use, so not just using it, but actually knowing how to use it correctly. And finally is stress level. Now we know that stress cannot be avoided, but there are different levels of stress. There's everyday stress, and then there's stress that can severely impact one's ability to effectively work safely in a laboratory environment. And this is something that people should assess daily before they plan on commencing any activities in the laboratory. One of the pieces discussed about biological agents are the routes of transmission. Routes of transmission can include direct contact or person-to-person contact, indirect contact through inanimate objects, also known as fomites, inhalation of the infectious agent through contaminated droplets or aerosols, ingestion of the infectious agent through improper hand washing practices or contaminated materials, and or through percutaneous transmission, such as accidental needle stick injuries. Biological agents can have more than one route of transmission, and some are accidental infectious agents in that they don't normally cause disease in humans until they are introduced through unusual means. This is important to assess prior to doing work with any kind of infectious agents. Another piece discussed with biological agents are the infectious dose. The infectious dose is the number of microorganisms required to initiate infection. Here are a few examples of infectious doses for commonly used biological agents. For example, a typical E. coli needs about 10 to the 8th colony-forming units to actually establish any kind of infection in a human. However, if you look at E. coli O157H7 within that species, it only needs 10 colony-forming units to actually initiate an infection in humans. Salmonella species need anywhere between 100 to 1,000 colony-forming units. And a measles virus only needs a single virus to initiate an infection in a human. Another important piece of biological agent risk assessment is the risk group classification. The NIH and the WHO recommend these 4 risk groups based on the characteristics of the agent, so its ability to infect and cause disease in a susceptible or human or animal host, its virulence as measured by the severity of the disease, and the availability of preventative measures and effective treatments for the disease. Those that are low risk to individuals in the community are classified as risk group 1 agents, and it goes from risk group 1 to risk group 4 agents. After you've assessed all of the characteristics and different pieces of the information gathering process, you will prioritize risk. This is looking at the probability of something happening if you don't mitigate the risks. So the probability is what is the likelihood that something could happen. The consequence is what's the consequence of something actually going wrong. If you take and multiply the probability by the consequence, that's what you get. That's where you get the risk. So if you have a high probability of something potentially occurring and you plan on working with a risk group 3 agent, that's going to be a high consequence for not mitigating that risk ahead of time. And so that's what this chart is showing, is that when you have the higher the risk, the higher, and the higher the risk group of the agent, the higher the potential for that consequence to be very, very negative. So of course, one of the things you want to do to reduce risk is to either mitigate or eliminate the risks. And the easiest way to mitigate a risk is to eliminate it. Of course, in biological research, if you plan on working with an infectious agent, that's typically the greatest risk, and you really can't eliminate it that easily. However, there may be other things to consider. Determine if the risk is an acceptable risk. If you can't eliminate the risk, consider a substitution. If there's a safer agent, such as non-pathogenic E. coli versus pathogenic E. coli, maybe work with the safer form of E. coli first before moving on to working with the pathogenic E. coli. If there are safer procedures that reduce the risk of an exposure or an accident, then do those. Find ways to not generate aerosols or minimize risk through engineering controls. A certified biosafety cabinet can help protect both you, your product, and the environment, and is an excellent choice for mitigating risk if you know how to properly use one. Modern centrifuges with sealed rotors prevent splash and aerosol generation if a tube breaks in the centrifugation process. Ultimately, the best way to reduce risk is education and communication. Training, education, routine monitoring, and standard operating procedures all play a role in risk mitigation. And of course, after you've looked at all other angles, you move to the PPE and you wear it to minimize the risk of exposure. And not just what you wear, but have that SOP in your group that you use and follow for the proper donning and doffing of PPE. So how do you implement everything after you've developed it? If you're the principal investigator or the lab manager, you need to have regular meetings with your personnel and lead by example. Practice what you preach and make all procedures and expectations accessible and well communicated with your personnel. If a standard operating procedure doesn't work 100% of the time, revise it. Review materials as needed. As the PI or lab manager, it's your responsibility to maintain approved biosafety protocols, current lab inspection files, standard operating procedures, and lab manuals in an easily accessible location, and make sure that you are routinely reviewing those and updating them as necessary. Other lab personnel need to make sure that they work with their PI to understand how to use the equipment, understand the risks associated with your work, make sure you're adequately trained and educated in the work that you will be conducting. And of course, after you've implemented everything, you continue to review and evaluate. Regularly reassess all of the experiments you're conducting in your laboratory. Talk about concerns or if you have unexpected results. Communication is key. Communicate any issues, accidents, and spills. If these happen, review your materials and revise to reduce the likelihood of an incident occurring again. Review your materials with the biosafety program and discuss any concerns or questions you may have about the procedures. You are always welcome to contact the UWM Biosafety Program at uwm-biosafety@uwm.edu. This concludes Module 2, Risk Assessment. Complete the short quiz to move on to Module 3.